In the next 20 minutes, I will be providing a quick update on the latest ISO 45001 developments, and I will then be spending some time on the novel ISO 45003. So please feel free to ask any questions during the presentation. Yeah, I thought this was a good summary of the current developments. Oops, sorry. Sorry about that. Yeah, so yeah, we might be aware of the key ISO 45000 standard as such, but well, as part of the international working group, this is the ISO TC 283. There are other developments going on that we could also expect some publications in 2022 and 2023 as well. So I will be quickly commenting on first on the ISO 45001 practical guide for small organizations. So that guidance is already available as from September 2020. And this is basically a handbook that provides practical advice to those that traditionally have challenge with management systems, such as small and medium enterprises. ISO 45002, it's an ongoing development and due to be published in mid-2022. And this is about general guidelines on implementing ISO 45001. This is meant to be to provide best practice examples together with a basic, more advanced guidance to enable organizations to understand how the requirements can apply in really different contexts. ISO 45003, and this is the one in relation to managing psychosocial risk, which I will go into more level of detail later on. We also have ISO 45004 ongoing guidelines developments, and this one is in relation to performance evaluation. So the document will provide guidance on the development, implementation, and evaluation of performance evaluation indicators, with a particular focus, I must say, on the so-called leading or proactive indicators. And the last two, which you might be already aware, ISO 45005 was urgently developed as part of the public health pandemic. So this is general guidelines for safe working during the COVID-19 pandemic that was, as I was mentioning, published in December 2020. That intended to complement any existing guidance and regulations on the subject. And we would also be expecting ISO 45006, and this is in relation, much related to the previously commented, preventing and managing infectious diseases at work, again, guidelines for organizations. So this future guidance would be able to, to protect workers and other relevant parties from the risk related to infectious diseases. So, in a nutshell, these are the ongoing developments and what has already been published as part of this international working group. IOSH was pleased to be elected as an ISO Category A liaison body back in January 2014. And since then, we have provided two experts to contribute to the international working group. As a liaison organization, IOSH contributes to the continual improvement of the management standards processes to develop international standards that will, as we all know, ultimately provide benefits to business and workers and in general to the society. In the slide, you can see, the other list of liaison organizations that they tend to be both international bodies or European bodies as such. And summarizing some ISO 45001 characteristics, it's an international standard that gives organizations a framework to improve, employee safety, reduce workplace risk, and create safer working conditions. And I think it's worth mentioning that the standard emerged as a need for a more holistic solution to help deal beyond the familiar, the traditional physical health and safety risk. And this is, for example, due to the impacts coming from the introduction of new technologies, changing working arrangements, different employment types, changes in demographics, and global emergencies, such as the ongoing public health pandemic. The completion of the transition from the previous standard, OSHA's 80,001, means that many more organizations have now fully implemented or are in the process of implementing ISO 45001. And as some of you might be aware, the International Organization for Standardization determined that this transition period would be extended due to the COVID-19 outbreak, so till the 30th of September 2021. And I must confess that the standard is proven to be quite successful in levels of uptake within business. So ISO 45001 currently has something like 200K valid certifications. So if we compare to other important standards such as or well-established standards such as ISO 14001, it has currently has 350K certificates. So that probably will give us an impression on how positive, it has been welcomed by businesses and the industry. As we know, the standard has a strong emphasis on developing a robust and proactive occupational safety and health culture, focus on identifying and addressing hazards, risk, but also opportunities, which is one of the key differences with the previous OSHA's 80,001. And this, of course, includes sources of risks of a psychosocial nature. By psychosocial factors, we mean those that can or have the potential to impact the design of work or how work is organized. Here we're talking about things like excessive working hours, poor leadership and culture, poor communication, excessive production pressures, bullying and harassment. All those are factors, as we know, that can negatively impact on workers' mental health and well-being. And one thing that is worth mentioning that this guidance and the ISO 45001, this guidance in particular, ISO 45003, is really targeted to employers and workers' representatives, health and safety and well-being professionals, but also to human resources practitioners, occupational health professionals, employee assistance companies, and consultancies as well. And yeah, when it comes to work-related psychosocial risk, this is more or less a summary of the historical challenges in the management of this risk. So we know that the lack of awareness has been an issue. Not only in non-industrialized countries, but also in industrialized countries as well. There are some massive competency gaps. From practitioners to professionals, policymakers, and others. Another important aspect is that there hasn't been a risk-based approach to these risks. So, non-systemic approaches to managing this risk. And there's also been issues in relation to the terminology. So the standard talks about psychological health and safety, but we also know that there are other terms such as mental health and well-being, or work-related psychosocial risk. So in different countries, they tend to use different terminology. And I think this is something that the standard and the guidance have tried to tackle really. So yeah, I think this is picture of the current working group, or the international working group that helped contribute to develop the existing guidance. So we know that psychosocial risk do not need to be approached solely through an OSH or human resources perspective, but more from a strategic perspective at the organizational level. And I think that the international working group was a true reflection of these principles. So we had occupational psychologists involved in the working group, risk management professionals, occupational health experts, and of course, health and safety and human resources professionals as well. So this multidisciplinary approach, I think, really helped to provide best practice guidance. And from an organizational perspective, we know that for many years the focus has been on work-related and things. Issues such as work-related stress, more recently on depression, anxiety, and mental ill health, more as outcomes. But the new guidance standard, together with other like-minded trends, help to support this shift from mental health disorders to work-related contributing factors by providing systematic guidelines for employers to promote healthy workplaces. So at this point, I'm just going to play the introductory video that was produced as part of the work. Yes, so the summary video was mentioning on the term future guidance, but this is not future anymore because it was published last year. I think it's worth noting that the guidance is publicly available on a read mode only on the ISO website. So I'm quite happy to provide the link later on through the chat function. And this was made as part of the COVID-19 response. And so this guidance, together with the ISO 45005 that specifically deals with the risk coming from the pandemic, are both publicly available on a read mode and only. Yeah, so summarizing, I think, yeah, I mean, the slides talks about the inclusive nature of the guidance and the suitability for all types of organizations. I mean, we know that traditionally only big corporations or multinationals tend to tackle the issue with a more systematic approach, but the standard provides lots of examples and practical advice also for smaller organizations as well. And the guidance helped really to identify how psychosocial risk can arise from how work is organized, and social factors at work, and the work environment. And I think this is much related to the culture. And so, as I was mentioning before, yeah, the focus in the past has been on more on the outcomes, talking about stress or depression and anxiety, and not really the work-related contributing factors. So that's the main focus of the guidance. And as the video was saying, it is absolutely critical that psychosocial risks are managed in a manner consistent with other OSH, occupational safety and health risks. And this can be carried out through the lens of a risk management approach. I mean, irrespectively of we're talking about physical risk or mental risk, integrated into the organization's broader businesses process. And for that reason, businesses need to incorporate this risk within their strategies and into management systems and business operations. And I think one of the things that the guidance might contribute is to educate not only professionals, but also employers to know how to articulate and develop this. These are some of the key clauses that ISO 45003, and for those with some knowledge of ISO 45001, it basically replicates the same structure. So a message that the guidance clearly resonates is that organizations need a broad-based and visible leadership and support in order to develop their own mental health and well-being strategy. So the success of the psychosocial risk management is really based on the company overall strategy and alignment and commitment from all levels and functions of the organization, and in particular from the leadership, from the top management. So it doesn't say anything dissimilar to 45001. And another important aspect or key clause is the one in relation to performance evaluation and management. So here it's basically saying that evidence of the impact of initiatives need to be better measured and reported. We all know of different training or raising awareness initiatives that can be done on an individual basis, but well, the guidance says that there's a need to review really those interventions and see how they can provide or not a positive return on high impact areas, respectively of the business size, the budget that the organization might have, or the capacity, talking about here, the human resources that the organization might have to support this strategy. And also special attention needs to be placed to those investments that have the potential to create a positive impact on the so-called bottom line. And because this, as I was mentioning before, there's evidence that demonstrates the lack of appropriate expertise and the lack of organizational awareness. Yeah, I'd like to remit to resources and content that the Institution of Occupational Safety and Health has already publicly available for professionals. So we commissioned research in different aspects in the past, and I think we also did commission some recent research on the mental health and well-being impacts of on the pandemics on the workforce. Yeah, there are also some training and raising awareness products as such. And on our YouTube channel, we've also developed some freely accessible webinars covering in particular some key features of ISO 45003. And this is because we know it's a novel guidance. So there's really a need to better understand how to deal with this risk. So yeah, we believe these are excellent examples of content and resources. And yeah, and given the platform, I would also like members or colleagues to access the ISO website on 45001 and the ISO International Working Group and Committee website as well, in case they would like to know more of future developments that might be happening or being published in 2022 and 2023 as well. So yeah, I think that's everything from me, and happy to address any comments or questions. Thank you, and again, thanks for the invitation.
Ivan, thank you very much for your presentation. Just going on to questions, I think one of my comments before I do get into the question that's been raised is that I think you touched very eloquently on the fact that the measurement of psychosocial hazards in the workplace is not done very well at this point in time. And I think ISO 45003 will obviously assist with this. But I think what is also important is, are you aware of any other methods that readers could use or our audience can use to measure the psychosocial risks in their workplace?
Yeah, thanks, Karen. As I was mentioning, 45003 provides some guidance on how to measure, but this can be complemented with existing practices or from businesses. And yeah, it is true that countries like organizations in countries like Canada have already published, and like big consultancies have already published on that particular topic. So when talking about the return on investment of some specific interventions or initiatives, they have published really interesting reports on this. I mean, basically saying that it is better to have overarching strategy rather than focusing on one or two interventions that might be difficult really to measure.
Okay, thank you. I think that's one of the things that that we can perhaps do for our audience. I mean, I've been doing some research for a recent webinar, and a lot is said about the Copenhagen questionnaire that we can possibly use as a form of measure, and maybe going forward into the future, something that should be looked at in more detail as possible areas of research to assist members. There's one question that's been raised by Dr. Dipsik Dar, and forgive me if I've got the pronunciation incorrect. But Dr. Dipsik Dar is from India and would like to know if you have some guidance on ISO or OSH auditing training that would be applicable to physicians working in manufacturing units, and from what I can understand, also specifically looking at the occupational health clinic function of the organization. Have you perhaps got any suggestions?
Not that I'm aware of. So as we know, 45001 is certifiable, but that it's not the same thing for, that doesn't really apply to 45003. So organizations yet cannot certify on that, because here we're talking about guidance. So this is a more voluntary standard as such. And I mean, as the question was mentioning in relation to more ISO or auditors and courses or training for physicians, yeah, I would probably suggest going through the national certifying bodies. So I think that would probably be the most sensible approach.
Thank you very much. There's one other question that's been raised by Kim Davies, and she's asking, would it be better for the industry to work closer with the psychosocial team and do workplace interventions on a regular basis?
Yeah, I mean, well, that's a really good question. So as I was mentioning throughout the presentation, collaboration is key, and in particular for those, probably this has happened in the past for those big organizations that they do have both internal and external resources, but that doesn't mean that those resources have been really well aligned. And for the small organizations, probably they might be lacking from internal resources when it comes to even like human resources or occupational safety and health, but they also have the possibility to go in external accessing the wealth of information that is already out there on the subject of mental health and well-being.
Thank you. Just as a form of close here, I think for me, from a personal perspective, COVID has brought to the fore the need to manage psychosocial stresses in the workplace more effectively. And I mean, the fact that ISO 45003 has been published and released, you know, in the recent past bodes well. But I think it is true to say that these are the hazards that traditionally have not been managed very well, but going forward are going to get the deserved attention so that we can actually truly provide our workers with a safe and healthy working environment. Ivan, thank you very, very much for your time today. We appreciate your presentation. And from all SCAP members, thank you very much.